the HOVON group, Sonia Swigman presented the data that which has been recently accepted for JCO. This is the HOVON 143 study, and it is a comparison of Ixazomib-dexamethasone. And this study is providing good and acceptable PFS for patients who are meeting the criteria of frailty. So in this very difficult study population, this combination of daratumumab, Ixazomib, and dexamethasone has produced a PFS of 13.8 months, but it is much less, of course, than the Maya study, DARA-RD arm. And the PETEME group, during the session, Maria Mateos was presenting their new studies, GEM 2017, which is trying to recruit patients who are about the age of 65, but who are more fit patients, and thus they will be able to compare the traditional VMP regimen versus KRD and plus DARA and KRD. So the study results will certainly be very interesting. And also another approach is for the elderly patients to try to get rid of steroids. And among these, the French group and the Italians have two different approaches. On the study which is ongoing by the French group, they are now going to be comparing the Maya approach, lenalidomide, but excluding the steroid, and comparing this regimen with Landex, but this time with low-dose steroid. So this will be a very interesting combination, and the results will hopefully lead to a steroid-free regimen in future. And the Italian approach was led again by Alessandro Larocco. She was planning to include intermediate frailty presenting patients and trying to compare starting with the RD regimen. So, and after 9 cycles, stopping the steroids and continuing with only lenalidomide, comparing the patients to those who continue with both lenalidomide and dexamethasone. So here the question is getting rid of steroids in the maintenance phase versus the French study, which is trying to approach this starting from the beginning. And apart from these studies, there are now 2 more studies, which is also including patients at the diagnosis stage, but above 65, but below 75, so more fit patients, and with a quadruplet regimen. So, encouraged by the results of the Griffin study, here Cepheo study is combining DARA with VRd, and in the other CD38 Isatuximab combination, Isatuximab plus VRd combination is being tested in the IMROZ study. These 2 studies have completed accrual, and we are hoping that we will be able to receive results by the end of this year or the beginning of 2022. And the future is such that elderly patients, if they are frail, we must approach them with the more effective regimen and start to an induction regimen that they can tolerate and reduce the toxicity based on their COMy frailty score. But those patients who are more fit, these patients should be referred to more efficacy presenting combinations, and certainly these patients are more tolerable, and their disease deserves a more intensive approach.